Greetings. Let us learn about the anatomy of the colon. In this section, we will learn about the different regions of the colon. And let's go. So here is the colon, and we have passed the endoscope to the beginning of the colon, otherwise known as the cecum. And once you are in the cecum, you identify the cecum by the opening of the appendicular orifice. So here is the appendix, and this is the opening that you check and take a photograph. In order to be sure that one has reached the cecum, it is not only important to take a photograph of the appendicular orifice, but also document the small intestine entering the colon. So we pass the endoscope into the terminal ileum and take photos of the lining of the terminal ileum, which shows the villi. The reason to take a photograph of the terminal ileum is to ensure that we have reached the cecum. Sometimes people can make a mistake when they have reached the hepatic flexure and assumed that it to be the cecum. And I have seen where someone thought that they have reached the cecum when in fact the endoscope was near the splenic flexure. One way to be absolutely clear and certain is to take a photograph of the terminal ileum, and nobody would doubt about your finding that you reached the cecum. As we pull back the scope from the terminal ileum, we go to the ascending colon, then hepatic flexure, and this is under the liver, and this is the bend where the ascending colon takes a bend and goes to the transverse colon. Under the spleen, another bend, the splenic flexure, descending colon, sigmoid colon, rectum. Upper portion of the rectum, lower portion of the rectum. And once you get to the lower portion of the rectum, the endoscope is pushed and turned on itself to look back. That is called as retroflexion. And in the retroflexed view, we see the lower portion of the rectum and the anal canal, and also hemorrhoids, especially internal hemorrhoids. Then we straighten the scope and come back. So let us see how these different sections look when you're watching through the colonoscope. So say for example, you pushed your scope all the way back to the cecum and looking at the appendix. This is the appendix opening here, and this is how the appendix opening looks with a nice circular folds around the opening of the appendix. And if you pull your scope back, you will see the cecum. And sometimes this can be seen in different sections of the colon, especially hepatic flexure, splenic flexure can have the similar appearance, and you shouldn't be fooled that you reach the cecum. And when you are in doubt, you should always make sure that you check whether you can see the villi of the terminal ileum by intubating the ileum. So here you see the villi, and when you see the villi, you know that you have reached the terminal ileum that is close to the cecum, and you can be sure that you have reached the cecum. So when we reach the cecum, we should take at least 3 photographs. One photograph to document the appendix, base of the cecum, ileocecal valve, and for sure document the photograph of the terminal ileum, which will be the most convincing evidence of you reaching all the way to the beginning of the colon. Next, as we come back, here is the ascending colon, and in a distance you can see the ileocecal valve. And then as we come back under the liver, the hepatic flexure, the liver can be seen through the wall of the colon. It gives a bluish hue. So here is this is the hepatic flexure, and you can see the bluish hue of the liver. And as we come back into the transverse colon, you have these triangular folds, which are classic for transverse colon. And as you come to the left side, you see the shadow of the spleen. Sometimes that is the splenic flexure, as you can see here. With the patient lying on the left side for colonoscopy, as you come to the splenic flexure, you may see a puddle of fluid as well. So another way to figure out whether you've reached the splenic flexure. And then the descending colon, wide open. Splenic, sigmoid colon, where the folds are round and they're very narrowly interspersed, not at much distance, but narrowly interspersed. And then once you come into the rectum, you see the 3 valves of Houston. I'm based in Houston, and for the sake of understanding, these valves are called the valves of Houston in the rectum. And when you do the retroflexion, you see the scope, and it's turned back and is looking, and these are the inferior rectal veins draining into the hemorrhoids. And once you straighten the scope and you pull back out of the rectum, take time to examine the anal canal as part of the examination. And you can see here a little bit of a hypertrophied anal papillae. So in this video, we have learned about the anatomy of the colon as we examine using the colonoscope, and different regions of the colon and rectum. And I hope this is useful. Thank you.